Hello again, this is Paige Greenewalt, recording the rest of my presentation for the Advanced Assessment Techniques for my Nursing 340 class. Here is where we left off in the first half. We did finish watching the video, the video of the assessment, so please refer to part 1 or the first link to see that. Alright, so to follow up from the video, the assessment video, a couple of things about the physiological landmarks. With the MoCA test, it's kind of hard to point out any physiological landmarks, but some things that nurses should be aware of when they're completing this exam on patients is, of course, the cognitive considerations. So that can be that patients who are already diagnosed with a cognitive impairment, and we are just doing this MoCA test to keep track of their cognitive decline over time, we want to know that those patients are going to take a little bit longer time to process what they're being asked. And because of this, it might take them longer times to respond. So just having patience when you're giving a patient this test. Knowing that those patients are going to have, again, slower communication times. So just be patient, tell them that it's okay if they're taking a long time to answer. Let them know that there's no rush to complete this test. And it should also be administered in an area with minimal distraction. So try to be in an exam room alone, try to be in the hospital room alone. Don't have family there trying to give them hints to the answers. Alright, as we discussed a little bit in the actual assessment video from part 1, there is normal versus abnormal findings with the MoCA test, as there is with any test. The MoCA test uses a scoring system, giving the patient points for each section or question that they answer correctly. It is important to note that those with under 12 years of education do receive 1 extra point on the at the final score to account for this. So a normal finding would be a test result of greater than or equal to 26 out of 30. This would indicate normal cognitive functioning. If you need to, you repeat the test in a year at their annual physical, or unless a acute concern comes up about memory, but otherwise, you're good. Abnormal findings would be a score of less than or equal to 26 out of 30, would indicate some sort of early signs of cognitive decline. Oftentimes, these patients then get referred to a neurologist for some additional testing, which we will actually discuss later on in this video. Abnormal findings, of course, can indicate any cognitive disabilities or diseases. These can be things like Alzheimer's, dementia, can also be an acute cognitive problem, such as a hemorrhagic stroke. People with Parkinson's or Huntington's disease will often get these tests, and people with traumatic brain injuries will get the MoCA test pretty frequently as well, just to check if there's any change in their cognitive status. So the pathophysiologic behind completing a MoCA test or behind these diseases. So Alzheimer's is a form of neurodegeneration. That's when plaques form in the cerebral cortex of the brain, and that part of the brain is responsible for the person's memory. Cerebrovascular diseases such as dementia or stroke obviously cause brain damage, so that leads to areas of cognitive decline. Parkinson's or traumatic brain injury affects the frontal lobe of the brain. That part of the brain is responsible for impulse control and problem solving. So we know that patients, even patients with dementia, they can have issues with impulse control and have some behavioral disturbances. So obviously this is important to keep in mind. And chronic conditions such as multiple sclerosis or encephalitis cause neuroinflammation or an infection in the brain. That's what encephalitis is. That can cause impairments in cognitive status. So related nursing assessments that we would also want to complete at the same time. Of course, the MoCA is focusing on the neurological system, so it would be important to maybe complete a pupil assessment, the PERLA assessment, making sure that the pupils are both equal, round, reactive to light, and accommodations. That's what that stands for. So, of course, if we're a nurse in the emergency room and a patient comes in with acute altered mental status or acute cognitive decline, we would maybe want to complete this assessment and check for signs of a stroke. Same with the motor strength and coordination. Of course, if a patient is actively having a stroke, maybe their strength on both sides is not going to be the same. Their coordination, their cognitive functioning is all going to be kind of out of whack. So that's important to assess as well as the level of consciousness slash level of alertness. So first, with the alertness, it's important to know if the patient is awake, alert, oriented to time, place, situation. And of course, you want to ask them if they know why they are there, if you're in the hospital setting. This is important to know as it kind of gives you a little bit of insight before you would even start the MoCA test on how that patient is going to probably answer the questions. Same with the level of consciousness. It's important to know what their baseline is before testing. If it's like a chronic Parkinson's patient and they're, unfortunately near the end of their disease, they're going to have a little bit more time or a little bit more difficulty being alert and oriented for the test. So some further questions that we would also want to ask the patient while we were completing the MoCA is to ask the patient or any family members if they are present, if there are any concerns about the overall memory or overall health of the patient. Ask the patient if they recently had any new onset of headaches, dizziness, episodes of confusion, or forgetfulness. This is all important to know as it could indicate some kind of acute cognitive change going on. Same thing with the vision, hearing, and speech. Any changes to those could indicate a numerous amount of health problems. And asking the patients if they're having any difficulty doing their normal tasks on their own. Sometimes in this kind of situation, if they are having difficulty, that could be an early sign of dementia. As we know, dementia patients often have time completing their tasks on their own. And some other tests that would probably be ordered is the Mini Mental State Examination, or the MMSE. That is often actually completed at the same time as the MoCA. It's kind of like the beginning step to the MoCA, and then if the patient fails the MMSE, they will go on to complete the MoCA. Same with the mini-cog. Mini-cog is more used in the outpatient environments, though. That is kind of the pre-step to the MoCA in the outpatient setting. All that involves, there's a picture of that right here on the slide. It's a three-word word recall. So you give them 3 words. You can choose any of these versions up at the top of the screen. And then you have them draw a clock, which is actually part of the MoCA assessment as well. But if they would fail this mini-cog, then that's when you would go on to complete the MoCA. You would want to do a depression and anxiety screening. Sometimes depression in the elderly can appear in odd ways, for lack of better terms. It can cause them to be confused, cause them to have lack of memory. Stroke assessment would be important if they are coming in with new onset of confusion. And of course, imaging studies like an MRI, CT scan to check for stroke if it is an acute situation, or MRI, CT scan to determine any changes in brain anatomy to determine if they do have a diagnosis of dementia or Alzheimer's. And here are the references at the end. All right, thank you guys for listening and watching my assessment. We talked about the MoCA today, which is an assessment that is used to check for early signs of cognitive decline and can be used over and over again, year to year, to check for progression in cognitive decline. Thank you for watching.